had a heart attack. And that was 11 years ago. I was 52. I was afraid, yes, very afraid, that this might be the end.
Donna Berkey has a lot to be thankful for. Despite life-threatening situations, she's still healthy, happy, and here for her family. Like so many others who live in and near Rocky Mountain House, Donna is particularly grateful for her local health center, and especially for the people and the businesses who provide extra, crucial support.
It's awesome that people have, donated towards the hospital to make sure we have this equipment in a small community like this, because things happen and you don't always get to the bigger centers.
The trauma department here is extremely well outfitted, thanks to supporters of past fundraising events. Their generosity has helped purchase every single piece of equipment in this room. Essential equipment like this warmer, which quickly regulates the temperature of incoming patients exposed to cold air or water. A pressure infuser, which helps give larger volumes of fluids to patients. A glide scope used to control the airway of people with neck injuries. And this emergency room ultrasound used daily in emergency situations to quickly diagnose patients, help find access to veins to start IVs, and is crucial for emergency patients who are pregnant.
Now, this ultrasound machine is a concept that is being used in most ERs. I want to state that we are probably one of the first rural facilities that actually implemented this system. Use now layman's terminology, but for us to use this tool, it's like a stethoscope for a doctor.
It's nearly impossible to grasp just how important your support is for the local hospital. It was people like you who purchased this $80,000 anesthesia machine, which ensures the viability of Rocky's operating room.
If we didn't have this piece of equipment and something had broken on the old one, we wouldn't be able to offer surgical services here in Rocky because the other one was no longer supported. So it would have shut down our OR program without this.
And in an environment where healthcare professionals are constantly fighting a war against germs and infections, it was your support that helped purchase stainless steel cabinets and instrument tables.
Obviously, it's easier to clean the stainless steel and make sure you're not cross-contaminating anything. We wouldn't be where we are without all of the volunteer dollars that have been raised from community members.
Community members and community-minded businesses are a major reason Rocky Mountain House is one of the best places to live anywhere.
I've traveled across Canada and worked in most of the provinces, and I still haven't found a place as nice as Rocky to live. The demands on the hospital keep growing. I think things like the hospital gala are important, and I'm particularly like it because all the funds that are raised stay here in Rocky Mountain House.
There's just a lot of our employees that live here, and and they can get the services that they need here. So I'd like to give back to the community as much as we can, and to our people, and to surrounding areas.
If you want to get people to move here and stay and work, you should have good health care. We just believe that's where we should spend some of our money. It's our local people, stays locally. It's where it should be.
My own daughter was one of the first ones that needed the ultrasound used on it, and I felt so blessed to think that we had this in our facility, and it was an emergency situation. So yes, we all, whether we work here or we're in the community, we are all very blessed to have these pieces of equipment here.
We wouldn't be able to keep doing the things that we're doing in this hospital if we didn't have the support, and then that goes, from the OR program to the wound clinic to lots of other things.
We have lots of doctors in community. We've been able to retain and recruit over this past 5 years, and much of that has to do with the quality of services we've been able to provide with the enhancements. Community members who are investing in our local community healthcare services need to know they're making a huge impact and improving outcomes.
We need special equipment, and they are very expensive to provide advanced care. We can just say thank you, because these are the things that we need to run an appropriate emergency department.
It is gratifying to know that you were part of helping somebody. in the hospital itself. I've used it, my kids have used it, all my grandkids were born there. It's been an important part of our lives.
They're awesome people, like awesome businesses that do this, and we really appreciate what they do. A good hospital is very, very important in the community, you bet. One that we can trust, and that makes a lot of difference.
For Donna Berkey, a well-equipped hospital made all the difference in the world. This year, the goal is to purchase state-of-the-art cardiac care equipment. This will assist both cardiac care patients and those with unstable medical conditions. By helping purchase this equipment, you'll ensure more lives will be saved at the Rocky Mountain House Health Center.
If some of us more established businesses can continue to lead by example and show how important that the healthcare system is to us, I think other people may follow and hopefully find it in their hearts as well as their wallets to give whatever they can.
I think you should give back to your community, that's all. You know, it's simple as that.